But having that knowledge right on hand, I think has been invaluable. I think a lot of people will say that it's been, you know, in occasions where there's been some complex issues, you know, that they've been really, you know, useful.
So we now have the expertise in the room, so we get the support with our 999 calls should we need to in dealing with maternity incidents, especially difficult deliveries, situations where patients are on their way to hospital and having to deliver in the back of cars, or complex calls that our call takers sometimes find quite difficult to deal with. They can now call on the support of a midwife for side-by-side advice and support throughout the call.
I had a call come in from a dad who was driving his wife to the hospital, and his wife was in the process in labour, pushing, and I got the call and I was like, you have to pull over, trying to get the midwife also over at the same time, because I realised that the situation was not ideal, that they were on the side of a road with no other support around. So she was able to come over and assisted with the call to find out exactly how far along she was. The baby was on its way, we saw its head coming, and we were able to successfully deliver a baby.
It's been nice that we've been able to interact with some calls and actually stand ambulances down and say actually they don't need one, because the pathway might say they need one, but actually with us finding out a little bit more information we can say actually they don't need it, they can go in a car, it's safe for them to go in a car, so that ambulance can then be redeployed elsewhere.
I produce a weekly report which gives us all the data on how well it's working, and we can see from there the number of downgrades that we're getting from the midwives and the number of stand downs we're getting from the midwives. So we are seeing an impact there, but we would like the impact to be a lot more than what it is, and that's what we're working towards at the moment, improving the impact that they're having on our 999 calls.
I think we need more involvement with the maternity calls and the imminent delivery calls, because sometimes we're not called over, and having a baby isn't always plain sailing, and the reason we're here is to help with calls.
So we're looking at training the midwives on the Manchester Triage clinical decision support software, which will enable them to work closer with our EMAs and actually take the calls off of our EMAs rather than being side by side. So the EMAs will be able to warm transfer the calls to the midwives, who will then be able to carry out the triage themselves on those patients more effectively.
This is the way of integrating for the future. We've got such a shortage of clinicians nationally. We shouldn't be keeping clinicians moving around when they can actually stay where they are and just rotate them within the roles they are in and work within disciplinary teams. So bringing in mental health, but we will supply some, but the providers will supply some. It brings sharing of information, sharing of patient notes, and really helps us get the right patient care straight away by getting them to speak to the right clinician with the right information in a joined up way.
Do you know what? They've been really helpful, and you know, they've all been really nice to come in. They've shown us a couple of labours, like with, I want to call it like a resusciani, showing us how the babies get delivered, and they seem really willing to want to share that knowledge with us and help us improve that aspect of it. So yeah, it'd be really good.
It's been great. Obviously we've got lots of learning to do because it's a new initiative, so all the time we're learning as we go, ways we can improve, but it's been really nice. It's nice to work with a different team in a different working environment, especially with the call at 999 call handlers, to hear the calls and things like that coming through and to help them with the calls as well has been great.